Recovery can be a very tough journey to be on, but thankfully soul surgery provides an experience like no other that provides people the best chance to be successful on their journey. And joining us to tell about it is John Mulligan and Dr. Ray Hamilton here with us. How are you two doing today?
Doing well.
Good.
Well.
John, let's talk about, of course, soul surgery and a little bit of the history of this and how this all came about.
Yeah, soul surgery started back in like 2011, and we've grown to a place where we have several facilities in Scottsdale where substance use disorder and mental health, and have a unique approach to it.
Yeah, and again, these programs are so important, and what I love about soul surgery is that you guys don't just do a cookie cutter kind of program. You guys actually sit down with people, talk with them, walk them through the process, which is very important. And that's, Dr. Hamilton, we want to talk about is that, which is very important, is the DNA program you guys kind of like look at people and do. And that's something that's very important to people's recovery, isn't it?
Absolutely. If I were to briefly describe our model or approach to treatment, I probably use three common tools. Mm-hmm. You have the inventory or the behavioral inventory, and then you have the genetic component that you mentioned, and then there's a trauma correlation also. And so if I were to take the first two, I would say with the behavioral inventory, it's hard to fix anything if you don't have a problem in the first place. And so that denial barrier that we get, behavioral inventory facilitates the admitting phase. And so what we do is we establish good rapport. We have listening skills that most don't have time for, in my opinion. And then what we do is we are the link between the issues and their concerns, but at the same time, we have the responsibility of showing them how those concerns take away from what could be their quality of life. Yeah. So once we establish that and they admit that, then we transition into the acceptance phase, which is where we use the genetic components. Not so much as ancestry, but genetics as in taking a good family history, telling them about the higher probability they have based on genetics for certain diseases, conditions, mental health disorders, addictions. And then the other part is using the cytochrome P450 network of enzymes to highlight whether or not they're ultra rapid metabolizer. Yeah. And what that does is even if it doesn't result in them having a better outcome to therapy, what it does show is that we care enough to not make them a guinea pig. Yeah. So we care enough to reduce all the factors that we can to address the likelihood of side effects that could deter them from trusting us altogether.
Yeah, and John, that's what's so important about, of course, the programs you have there in soul surgery is that you want people to, as again, first admit they have a problem, and that's where your guys' team comes in to sit with them so they know they can trust you to actually make that step.
Correct.
And that's what's important there, isn't it?
Yes, getting from that admitting to accepting state, where then from the accepting state we can see the action. They make the decision to do the rest of the program, right? You know, and then the trauma analysis comes into play where we get to a point where, you know, if they need to do trauma work, and you mentioned trauma work, the fears come up and then the walls come up. Well, our unique approach is we get to the trauma just in a smooth flow pattern where they don't even know it's starting to come up. And once they're experiencing it, they start to feel that release and that freedom.
Yeah. What's also important too is that at this time people got to start admitting, and we are around that time where people want to start denying, they start looking at the stress and stuff. Yeah. And I think we've also had a bad image of what mental health is and addiction and recovery, and that's why you all take it as a different approach and making sure people kind of like, oh, you know what, you're not alone. Mm-hmm. And as you said, it's also looking at your background and support of that, right?
Absolutely. Trying to address complicated things like internalization, compartmentalization, things that are handed down through generations and perceived as normal. And we're here to try to break those barriers and those trends and those stigmas so that we can get down to the root cause of the problem.
Yeah. John, this is so important, especially as we know with men who really need to start talking more, and that's where we were saying that you want men to reach out, that you're here for them. We know that also that it's a family time too that can help support, and that's where soul surgery can help.
Absolutely, absolutely. We definitely get to the solution.
Yeah, that's so important. So information's right there on the screen about, of course, soul surgery, and to find how you can get help, please do. It's very important that you check out the facility, you see what you can be done. So thank you two for joining us.
Thank you.
Thank you.
There you go.